Hello everyone. In this video, I will be talking about carotid artery dissection. So simply put, a dissection of the carotid artery is a condition whereby the layers of the carotid artery get separated. And so this can happen either by trauma or it can come spontaneously. Statistically speaking, the dissection of the carotid artery accounts for about 3% of all strokes. And it is the most common cause of stroke for the young population. So the dissection of the carotid artery accounts for about 20% of all cerebral vascular accidents in the young population. This condition happens mainly to the internal carotid artery, and it usually happens 2-3 centimeters just above the common carotid artery bifurcation point. Let's zoom in here. So to understand better this pathology, we need to take a closer look on the actual structure of the carotid artery. So the carotid artery is composed of 3 layers. The innermost layer of the artery is called the intima. Okay, and so this is in yellow here, so you can imagine that this is the artery, the inside of the artery, the lumen. The right side is not represented, but you'll find out why in a few seconds. So in yellow, we have the intima, and it is composed mainly of elastic material and a single-celled endothelium, so it's pretty thin. Then we have the media. Okay, the media is in pink right here, and as you can see, the media is actually the thickest layer of the artery's wall, and it's basically made of muscle tissue. We need smooth muscle inside our arteries because they need to contract or dilate to control and to regulate blood pressure. The third layer is called the adventia, and this one is in orange right here, and it's pretty thick as well. This layer is mainly for protection, so it's going to be mainly made of fibrous material. I said before that it's a condition where the layers of the carotid artery get separated. So what's going to happen is we're gonna have the intima layer here, the elastic layer right here, and then something's going to happen to it. The media is still going to be okay. So here we have the media, which is not affected. Then we have our protection layer, the fibrous one. And so there is going to be a tear in the intima layer. And so what's going to happen is here inside we have blood, right? Now the blood is going to go in here to fill this space right about here. Here we have the actual dissection, and dissection means basically separated. So the layers are separated. So 4 different things can happen because of this dissection. The first thing that can happen, if more and more blood goes in, this can cause dilation of the arterial walls, and this can create a false aneurysm. And an aneurysm is basically a dilation of the arterial walls. So instead of having an artery that is like this, you will have something like this, where the artery is actually bigger inside than it was before. Next, it can cause stenosis. If the media and the adventia layers do not dilate, they do not expand with the artery, then the blood will have no choice but to put pressure towards the lumen, right? So here we have the lumen. So all this blood goes to the brain. So if you have less space than before, there will be less blood going to the brain, right? And so stenosis can cause cerebral hypoxia. And so again, if there's more and more blood accumulating, causing more stenosis, it can actually clog the whole artery, and so no blood can go to the brain. Now remember that we have two carotid arteries, so you'll always have some blood, some brain perfusion, but it can be greatly reduced. Now the fourth thing that can happen is a thrombus. Now all this blood coming in to the tear in the intima, the blood inside creates an intramural hematoma. So it basically clots. Remember that whenever you have something that breaks, in this case it's the tear in the intima, you'll have blood coagulation. And so we can have formation of a blood clot. Now this can be extremely dangerous. And remember when I said that dissection of the carotid artery is the main cause of strokes in the young population. And so this is exactly why. Imagine that there is this blood clot here, and this blood clot can go away from the wall. It can detach and it can go through the circulation. So it can go into the internal cavity, up into the circle of Willis and into your brain. And usually blood clots don't have a very serious effect on big arteries just because the lumen is so big. But imagine that this clot goes into your arteries inside your brain, and so those arteries are extremely small, and this clot can actually block the circulation into your brain and cause a stroke. Now, why is it that there is a tear in the intima in the first place? What is this all about? Well, the main causes are structural weakness of the vessel walls. Again, not very specific, but what can cause this weakness, right? There are a few congenital conditions that can naturally just decrease the strength of the walls. The first one, you could have something called fibromuscular dysplasia. This basically means there's abnormal growth of the cells in the intima layer, and we can also have something that we call Marfan syndrome. This is a congenital disease where there is a defect in the gene that is responsible for synthesizing a protein that is responsible to give strength and elasticity to connective tissues, especially arteries and blood vessels. Now, also keep in mind that the intima layer in the carotid artery specifically is very thin compared to other arteries in the body, such as the aorta, which has a very thick elastic layer, intima layer. And so just because of this, the intima layer is vulnerable to tears. Now, dissection of the carotid artery happens regardless of if you have these conditions, and so we find that the main cause is high blood pressure, so hypertension. These arteries have to be able to withstand high blood pressure, and so you can imagine blood going in very fast, exerting force on the inner walls, and so they have to be very resistant. So if you have hypertension, this can cause extra weakness on the intimal layer of the wall. And this is one of the reasons why we often say to control high blood pressure. In terms of clinical presentation, so clinically speaking, patients will usually report having some kind of a headache. They can also have facial or neck pain. And so this is in the case of the dissection. But you can also have stroke symptoms. And so just a quick reminder on stroke symptoms, because these are very important to know. Yeah, I'm sure you've heard of this before. It's the FAST acronym. Now let's have a look at what those letters mean. F is for facial drooping. So typically you'll see the face of the patient, especially on one side, will go down and will have no muscle strength at all. Then you can also have arm weakness or leg weakness, depending on which artery got blocked. S is for speech difficulties. And T is not really a symptom, but it just stands for time to call 911. And so keep in mind that these are the typical symptoms of stroke, and they usually happen on one side of the body, just because it's rare that both sides of the same artery are blocked at the same time. A dissection of the carotid artery is very hard to diagnose, especially if you don't have any stroke symptoms. But typically, the gold standard diagnosis is a CT scan with a CT angiogram. Now, the recurrence rate of this condition is about 10%. So 10% is not nothing, and this is why it's very important to monitor closely your blood pressure. So for treatments, you will have anticoagulation medication. You can also receive a stent, or if the dissection is really bad, you can also have carotid artery ligation. So I hope this video makes sense. I'll see you in the next one.